Welcome, everyone, and thank you for joining us for this week's U Miami Health Talk. The topic tonight is staying fit and safe during COVID 19. What is the new normal? Tonight's U Miami Health Talk is, of course, presented by the U Health Virtual Clinics. U Health expert providers are ready to care for you. Now, they can do this in our facilities or virtually, whatever you want and wherever you are. We invite you to learn also more about the measures we have in place to keep you safe, as well as your appointment scheduling. And all you have to do is visit umiamihealth.org. Tonight, we're going to hear from Dr. Stephen Henry, a sports medicine expert from the University of Miami Sports Medicine Institute, speaking on how to stay fit and safe during COVID 19. During Dr. Henry's presentation, we will poll the audience on questions that are relevant to the discussion, so please be interactive and participate in the poll questions. Your answers, of course, will be anonymous, I assure you, but they're an important addition to the conversation. Also, there will be a question and answer session that's going to take place at the end of the presentation. Many of you have submitted your questions in advance, but if you didn't, there's plenty of time. You can still ask questions of Dr. Henry using the anonymous Q&A feature that you see there at the bottom of your Zoom screen. You could do that throughout the entire presentation, and we will be fielding them and preparing them for Dr. Henry to answer. And now I'm pleased to introduce to you Dr. Stephen Henry, who is a faculty member of the University of Miami Sports Medicine Institute. He's an assistant professor in the departments of orthopedics and family medicine and is double board certified in family and sports medicine. Dr. Henry specializes in providing care for athletes. He happens to also be a team physician for the Miami Hurricanes and the Miami Marlins. He earned his master's in neuromuscular medicine and his medical degree from New York College of Osteopathic Medicine in Westbury, New York, and he earned another master's in physiology from New York Medical College in Valhalla, New York. Please join me in welcoming Dr. Stephen Henry. Take it away, Doctor.
Thank you so much, Eliana. I'll just go ahead and share my slide set here. But before I start, I just wanted to thank you and the rest of the team here at the University of Miami Sports Medicine Institute. Ultimately, our goal is to provide personalized care and to create an environment where we can focus on the patient. I thank Lindy and Jared for facilitating this meeting. And so I'm excited to speak to the audience today about this topic. I mean, in the presence of this pandemic, one of the things that I found myself, or a lot of family members reached out to me, and quite frankly, they didn't understand the difference between an outbreak, an endemic, an epidemic, and a pandemic. And so that's where I'll start the presentation and segue into it. So, this slide set just basically represents, an approach. By no means are we saying you have to do these measures. It's recommended by the CDC. And as I get into it, as you have questions, please feel free to ask and I'll tackle them at the end. So we'll just do a crash course in epidemiology here, understanding that an outbreak is really a result of a sudden increase in the disease in a particular point in time. And that's exactly what we had. In early December, we started hearing rumors of a novel virus in Wuhan, China. And then next thing you know, by March, that disease had spread across the world. And we started to see a caseload rise up in places like Italy, the UK, and of course, China, where it all started. And once this exploded in early January, and if we were to compare January to now, we have about 16.5 million cases. And I think it's important to understand the significance of that, because nowhere since the flu pandemic have we seen these numbers rise so exponentially.
Dr. Henry, if I may interrupt you quickly, can you put your slides into presenter view so that we can appreciate fully? Thanks.
My apologies. That's what I had. Are you guys able to see my screen now? And is it moving or no? I'll fix this technical difficulty here.
You had it on full screen a second ago, and I'm not sure if it was moving, but I did see full screen.
Okay. Is everyone able to see my screen now? And does it move?
It's not in presenter's view yet, and but it's good info. At least we get a chance to read it. But yeah, you have to put it into that other view mode
Okay.
so that
What
you.
I'll do is I'll ask Linda if you could go ahead and take over in terms of sharing, as I may be having an issue here with it. So you can go ahead and start from slide 5, and we'll.
Yeah. Well, everyone bear with us. That's the world of Zoom that we all live in now. But that's great, Dr.
But
Henry.
that in a nutshell represents what we've gone through these past few months, having the ability to be adaptable and flexible to that scenario. So
No question. And this topic is so, top of the mind. People keep saying, do I go back to my gym? How do I work out? How do I stay fit? All of these are important things to keep our immunological system good, well, and our mental state.
exactly, exactly. And so those are some of the things we'll tackle here. Let me see, hopefully Lindy can go ahead and start a presentation there. Excellent.
Okay.
Perfect. And we can just pick up from, yes, the curveball slide. Excellent. So as I was saying, it's spread significantly to about 180 countries in all 50 states. And so at the end of the day, when we came together as a university community and as a medical community, we sought to figure out measures to mitigate the spread of the virus, and then quite frankly, understand the nature of it and its infectivity and how it would impact our community. All right, we can move to so this is our first poll question here. I'll allow Ileana to take over.
That's right. So folks, have you or someone you know been infected with COVID-19? It's a yes or no question. Important for our discussion because this sort of gives us a framework. Have you or someone you know been infected with COVID-19? Yes or no? It is on your screen for you to answer. If you yourself or someone you know has been infected with COVID-19. All right, so wow.
Wow, yeah. So I mean, this is a small poll. We have 34 participants in our talk today, and for 83% of individuals to be affected, that's a large percentage. And so that goes to show that if you think about it, at least one person in your family or a friend by now knows someone or is exposed to the virus. And so when we take a look at this virtual map from Johns Hopkins, this is a running dashboard that the folks at Johns Hopkins have, and it kind of catalogs all the infections across the world, and you can even break it down by state. This is as current as 7/28, that was a couple of days ago. And obviously, we get caught up in the numbers and hearing about the cases and daily. And so one of the things we've tried to do as a community is while we keep track of the numbers, we recognize that we can't allow the increasing numbers to make us feel paralyzed. And so one of the ways in which we can continue to cope with the stress of this pandemic is through exercise, right? Exercise has always been a nice way in which we can decompress and serve as an escape. And we'll address some ways to exercise after we've spoken a little bit about the virus and how it works. The next slide. And so looking at the impact on a local level, we see right now that we have about 432,000 cases, and our testing positivity reflects around 12%. Total number of people tested, as you can see. And what's important is if you look at the bottom slide set, you'd really see where you identify trends. And this is what we look at in the medical community, so we can see if we're really making an impact. If we keep focusing on the overall increase in numbers, you may tend to become overwhelmed by that. Next slide. And so, of course, in order to be able to mitigate spread, you have to understand transmission. And everyone knows this. We know it goes, transmitted by respiratory droplets. It lives on surfaces. And, recently, in the beginning of the pandemic, everyone said, well, it's not aerosolized, so you should be safe just maintaining a social distance. And later on, we realized some studies showed that the virus is aerosolized. And so that caused us to, start talking about the use of masks. So the incubation period is important because once you become exposed, it can take up to 4 to 5 days for this to start showing itself. But on average, we're looking at 11 days, So think about it. If you get exposed to someone and you don't know, you're almost going around for greater than 10 days, going to the mall, talking to your family, friends, hanging out with them. So that means that on average, you can infect about, 2.5, 2.4 other folks, in your community. And so that's a significant number. In terms of symptoms, most people will be asymptomatic or they'll have low-level symptoms. But the ones that come to mind are, of course, fever, cough, shortness of breath, muscle aches, these flu-like symptoms. The one that we like to look out for is this loss of taste and smell. And I deliberately didn't put it on a slide set because I want you to think about that. If you have any relatives that are experiencing that particular symptom, be sure to have them screened for COVID. And so much of this is some information from the CDC, but I just wanted to, again, highlight the importance of knowing some of the emergency medical signs and symptoms. And this is what you see as instructed by this slide here. So the trouble breathing, the persistent pain in the chest, bluish lips or face, all those are signs of what we call hypoxia. And that's really the issue with COVID, right? And it can cause a severe respiratory distress syndrome, which oftentimes warrants a patient or requiring ventilation support. And that's where we get into challenges and a rise in the death rate. So what we know, most people are gonna be asymptomatic. 1 in 5 are gonna have more severe symptoms. Currently, we're estimating that the risk factors for bad outcomes are similar to the flu virus. And one of the things we're starting to look at is some of the lasting conditions that people will have after they've overcome their COVID-19 infection. And obviously for folks that have comorbidities, and that's going to be important when we talk about exercise, anyone who has comorbidities such as hypertension, diabetes, you're immunocompromised, those situations will be critical when it comes to making decisions about whether or not you should exercise in the gym, exercise outside, or exercise at home. So in terms of prevention basics, and I know you've heard this on the TV daily and all the social media platforms, wearing a mask is important, sanitizing your hands, maintaining physical distance. By now we should have all of this drilled into our heads. And while it may seem like common sense, our biggest thing is to make sure that our neighbors understand the importance of this. And so we come to the meat of the matter here is, how are we going to acclimate to this new world, and how are we going to go ahead and make sure that we can still have our way to decrease some of our stress while exercising? So there's really 2 schools of thoughts, and I'll talk about mask use first, and then we'll segue into other aspects. So generally speaking, using a mask is safe, especially when exercising. You want to make sure that you maintain proper social distance, that your facial covering fits appropriately. Some people worry about, well, my mask may become sweaty. Well, that's where you can use a filter and then have an extra mask on you as well. And of course, practice good hand sanitization as you're going through your exercise routine. One of the things here that I want to highlight, and this image is from an article out of the British Journal of Sports Medicine, is that it is critical that if you have any sort of existing heart or lung condition, that you meet with a sports medicine provider like myself or your own doctor to try to figure out a good strategy to get back into your routine. You simply don't want to slap a mask on and run out, go out there and start running. For the folks who are relatively young or have no underlying health conditions, generally speaking, it may be okay, but you want to be cognizant of your underlying health conditions. So, by now, if you've been to the gym, most gyms are gonna have mitigation remedies in place. Some of the things, most gyms should have a way to do general temperature checks. They should at least send you a screening health questionnaire prior to your arrival. Once you're there to gym, you should make sure that you have your mask and that you're wearing it correctly. Again, there's emphasis on washing and sanitizing your hands before and after use. And obviously, the big thing is if you have a fever, don't show up to the gym, or if you have symptoms of COVID, don't show up to the gym or Don't go out for walks where there'll be large groups of people congregating. And so one thing, we talk about this process of making sure you can acclimate to wearing a mask. Again, I want to emphasize that the masks themselves don't significantly lower blood oxygen levels. I mean, currently we have no studies that show any impact on breathing with mask use. What we do know is that wearing a mask can sometimes simulate altitude training. And so in that setting, it may in fact help you with long-term overall exercise capacity. And so that may be something that may work out to your benefit, especially if you're an athlete and you're getting ready to, or if you're getting ready to get back into your exercise program. One thing to consider is this talk of doing sub-maximal exercise. What that means is you put your mask on, you're not going to go 100%. You probably go to about 50% capacity in whatever exercise move you're doing, and thereafter see how you feel. So this is really a trial and error. Most people will tell you, Doc, the minute I put my mask on, I feel exhausted. I feel like, I'm suffocating. But there's going to be some time where you have to acclimate it. So don't get frustrated, because then you'll get, frustrated, and then you may get anxious, and that causes you to hyperventilate in the mask. Next thing you know, you're having an anxiety attack at the gym, and, we don't want that scenario. The other thing is try to pair your exercises, for example, like cardio exercises with low volume strength training, because in that setting, if you're doing, say, low volume bicep curls, simple moves, and you pair that with a brief cardio exercise, such as an air squat, those things will allow you to acclimate to your mask. And of course, think about making sure that your workout intervals have longer rest periods. Give yourself time to acclimate to it. And then one of the things too, I say, is wear a heart rate monitor. Your heart rate monitor will allow you to see if you're in your cardiac working zone. And so if you see your heart rate trending up at a particular level when you're exercising that, and you're not feeling comfortable, that may be a time to back off a bit. Okay, so again, I keep saying it, especially if you're in the gym in a setting where you're gonna have a lot, people congregating, please wear your mask. There's, the studies have shown that 80% of the times you're wearing your mask, you can decrease the spread. So please, please, please wear your mask. So the other side of the coin is, the World Health Organization came out and they said, while the slides before spoke about, well, wear your mask while you're exercising, it's safe. The World Health Organization is taking the position that, if you have your mask on, sweat can make your mask more susceptible to microorganisms, especially if you are, out and about and using the same mask. And that's why, as a university and in our group, and what I tell my patients is simply just wash your mask after use, or have an extra mask on you while you're exercising. And if you need to take a break, take a break. But don't use the same dirty mask every day. One, wash your mask, pretty much treat it like your undergarment. You have to keep it clean. So keep your mask clean. And of course, when you're in the gym, or you're in a setting where there's large groups of people exercising, practice social distancing. Now, if you're going for a walk in the park and you see that there's a large crowd of groups of people in one area, then walk the other way. Plan alternate routes before you walk so that you can anticipate that. Also, try to exercise at low volume times. Traditionally, in the evenings, people like to go for walks around sunsets, or that may be a time where you say, maybe I'll get my walk in earlier during the day, or I'll get my walk in after work around my neighborhood where there's a less volume of people in that scenario. So try to really think ahead. You have to think about planning your exercise routine.
All right, so that leads us to the next poll question, but Dr. Henry, this is critical, everything you're talking about, because we've heard the do's and don'ts. First, they said, don't wear masks. Now, yes, wear masks. So stick with us, folks, because there's a lot more to learn. But here's the poll question on how active have you been since the start of the pandemic? Number 1, very active. Number 2, somewhat active. Or the last bubble, not active at all. We're talking about exercise, so how active have you been? And I guess activity can range from just walking around your house to
Right.
looking at.
to taking your laundry detergent and making it weights while you do your resistance training, which I'm sure many of folks on this call have done.
There are the results there, doctor. So
Somewhat
24%
active.
today. Yeah.
Yeah, and this is where I try to encourage all my patients that just because we're in the middle of a pandemic, it doesn't mean that you should adopt a sedentary life. Once we start, sitting around and getting into the routine of working from home and then turning the TV on and getting into that vicious cycle, it's going to affect your mental health significantly. Suddenly you're going to feel your energy levels drop and say, why am I feeling this way? Why am I feeling down? Why am I feeling like the world, is falling apart? While there are some challenging times now, I think it's important to really try to continue to maintain activity levels in that scenario. So that being said, understanding what the minimum guidelines are important. So right now, the American College of Sports Medicine, even before the pandemic, recommended at least 150 minutes of moderate activity per week. So that means if you can get into the gym at least, or at least be active 3 times a week for a 50-minute interval, or exercise, do some form of exercise, 30 minutes a day, even if it's going for a walk, even if it's doing jumping jacks in your home, even if it's doing abdominal crunches, some basic move that will serve to give you substantial health benefits. So what our recommendation is at the Sports Medicine Institute is we design a personalized program to help you get back to your former active self. And so if you're in that 48% of individuals, that's where we want to help you. And that's why our virtual clinics are such a resource, because me or one of my partners, we can sit with you and say, okay, stand up, show me what a typical exercise routine is. We can literally walk you through what you need to do. If it means that I'm demonstrating exercises for you on the visit, I will. We take this very seriously because we want our folks and we want our patients to stay active and decrease preventable diseases, decrease the risk of preventable diseases. So anyone with any sort of orthopedic concerns, such as previous knee issues, those are the patients we'll spend more time with, and we'll try to encourage you to do large muscle group targeted exercises, such as walking, non-weight bearing exercises. If you have access to a pool, or even low impact cycling, rowing, those things will help you to get those large muscle groups and meet the demand, so you can get that substantial health benefit. And so really try to choose something that you're going to enjoy. It makes no sense to write a big plan and choose an exercise that you're not going to have fun with. So try to have fun with it. These days you have folks that are getting on virtual workouts together. So if you want to reach out to a neighbor or group of people, you can have an accountability partner in that sense by pairing your workouts and structure them over a 6 to 12 week period. And the reason I say that is, generally speaking, it takes you about 3 weeks to get into a habit of exercising. Thereafter, once you get to the 6 week mark, you're going to want something different. So this is where you'll have an ability to check in with myself or an exercise specialist, so that we can give you some ideas about that. In terms of understanding the difference between moderate intensity, vigorous, there are some examples I put on the slides here. But vigorous exercises are running, of course, is going to be one, jumping rope, any sort of a high intensity interval training. I would ensure that before you start such a program, you check with us, because if you've been sedentary for a while, jumping to a high intensity interval training program may set you up for an injury. So I would say start off with something moderate, like going for a walk. And there's no shame in going for a walk. People say, oh, I was so active before the pandemic. No, I'm here. It's okay. Just get out there, get moving. And so if you can start off, I challenge you to start off with just 10 minutes. Do 10 minutes, see how you do, write it down, write it in your journal or on your phone. I did 10 minutes of walking today. You'll see how much better you feel. Try to get out of the house, of course, with your mask. And then start thinking about things that will prevent you from exercising. So that's where we say barriers to exercise. So time, quite frankly, we all have time to exercise. We think we don't have time, but we have time. Convenience, fatigue, boredom. The fatigue factor may be other medical problems. So it's important, again, Ileana, that our viewers understand that those medical problems, you need to meet with a specialist prior to jumping into your exercise program. Again, I mentioned it earlier, but the accountability piece is critical. It's ensuring that if, not everyone can afford a personal trainer, but, you can have your friend that say, hey, I challenge you, let's try to get more active. Did you do 10 minutes walking today? Did you do your crunches? Did you do your squats? Can we go for a bike ride together? Can we, walk out to a part of the beach where there's not a lot of people congregating? Things like that will help with stress management, especially, if you get glued to the TV too often and get this doom and gloom mentality. We need to break away from that because the virus is here to stay. We just have to be adaptable and malleable and make sure that we keep our outlets such as exercise going.
Especially on that point, Dr. Henry, there's so many virtual offerings of workouts now online, so people can certainly do that. And also what you were saying is to try and exercise at off-peak periods. This question is perfect for that. Do you feel safe from COVID-19 when you're exercising outside, even around other people? Yes or no? Do you feel safe from COVID when you're exercising outside, even around other people? And Dr. Henry's advice is try and exercise during off-peak periods if you're going to be out and about where a lot of people congregate.
Yeah, that's what I expected. So for the 63%, this is, most people, again, I think because we're so early in the process, we're getting all this data. And, I think we will look back and say, it's better to overreact now and adapt the mentality that, okay, if you don't want to exercise outside, exercise at home. I think this is where that accountability piece comes in. And you have to have a little bit more structure. If you don't feel comfortable going for a walk, then, then stay home and try to plug into some of these virtual channels that Ileana mentioned that are so useful. You'd be surprised if, if you're feeling down or your energy's down, getting up and doing 10 push-ups, doing an exercise routine for 10 minutes may lift your mood. And maybe we can get you from that 63% into the other percentage and, go for a walk at a time when there's not a lot of people around so you can decrease some of your stress. All right. So again, if you are going to go outside, wear a mask. Ensure that my approach is if I'm going to be outdoors, I have my hand sanitizer on me. I wear my mask and I try to go to any facility or anywhere if I'm going outdoors at a low volume time. I maintain physical distancing. Now we say 6 feet. Some people, you read some studies that say, well, in a Norwegian study we'll talk about later, they say 3 feet was enough, but 6 feet to me is ideal. And that's what CDC is recommending. Now, if you have a group of people exercising together, I wouldn't be congregating in that manner. For example, if you're going on runs or biking with a group, that kind of behavior will, even if you have your mask on, could theoretically increase chances of spread as droplets may come from sweat if you're in that large group exercising together.
And the $1 million question that everyone keeps asking about going to a gym. So like we pose this to our audience tonight, have you returned to working out in a gym? Yes or no? Anybody out in our audience today, have you returned to working out in a gym? Be curious to hear this because I think we get this question among our friends every week.
Yep, most people will say no. So, and I'm not surprised by that number. The issue is right now is that we don't want to be paralyzed by fear. We want to see what the data says and then make our decisions from there. And I think that's the approach we're taking at the Sports Medicine Institute. We're saying to individuals, if you are going to make the decision to go to the gym, here are some of the things you can do. If you're not going to go to the gym and you're going to stay home, we're encouraging you to stay active in that setting so that you can maintain physical fitness and benefit from exercising. So let me go to the next. So if you are going to go to the gym, there's one study that we found that showed, in Norway at around May 22nd or so, a group of experimenters said, you know what, let's test this theory. let's take 3,000 folks, split them equally, have one group that go to the gym and have another group that we have them stay home. And after about 6 weeks, we'll have everyone get COVID testing, and we'll look to see how the folks that went to the gym did compared to the baseline population, see if there's an uptick in terms of infection rate. Interestingly enough, out of all the people that went to this, the gyms, there was only one positive infection. Now, mark you, in this study, there was a low prevalence rate, which means to begin with, there was a low number of infections in that, in the society. But this was at 5 different gyms. It wasn't at one particular gym. The other thing about this particular study is that it wasn't peer reviewed. So generally speaking for the audience, when we say peer reviewed, that means we do a study, experts look at it, they critique it, and then they say it's suitable for consumption by the general public. And so what this study tells us is some of this raw data says, it is generally safe to go to the gym. And the kicker from this study is that these people weren't wearing a mask. All they did was they maintained physical distancing. They got undergo health screening questionnaires before going to the gym. And quite frankly, what it is, they had social distancing and they really tightened up on sanitation practices there as well. So while we may be consumed by the fear, so far the data is telling us, and again, this is a small sample, but we're encouraged by this. So that's why you've seen this push to tell folks, if you are going to go to the gym, if we have a study here where people weren't wearing masks and there was only one positive case, we may want to, and we're going to be wearing masks, it generally should be safe. And so these were the protocols. Again, they weren't wearing any masks, but these are some of the things that, I wanted to share with you. And if your gym isn't doing this, that's probably not the gym you want to go to, and you want to stay home. So these are some of the questions you should be asking the managers and the folks who run your local gyms. Are you controlling the volume of people? How many people are going to be, in the gym at any one period? Do you have signage to reflect social distancing? How often are you cleaning the equipment? Things like that. And if you're not comfortable with those practices, then don't go. You have the right to not go. This is where you're going to decide, well, I'm going to work out at home virtually, which there are a plethora of options to do so, or I'm going to go outdoors and do my exercise. And one thing I will say, Leon, about going outdoors, you don't necessarily have to go to a heavily populated area. There are plenty of areas here, in Florida, a lot of parks where you can go and have ample physical distancing and be able to exercise. So, I will tell folks that don't get paralyzed by fear. And so, team sports, that's the big question, right? Yesterday the ACC released their 11-game schedule. As you know, baseball season is underway. The NBA is underway with their bubbles approach to team sports. And some of the things that we're seeing in that setting is outside of the sporting or outside of the competition, they're wearing a mask, they're making sure that they're cleaning equipment. But for our local teams, some things to consider, and for families is, bring your own equipment. If you're going to be going for a round of batting or you're going to be playing catch, bring your own gloves. Don't share towels or clothing. Make sure that you keep your belongings separate from other folks. Again, the actual physical contact, such as high fives, handshakes, fist bumps, those kind of things you may want to avoid right now. And again, the number one thing is if you're feeling sick or you've been around others, it is our responsibility to protect our community. So I challenge you that, don't go and work out if you're not feeling well. Don't go and hang out with your friends if you're feeling ill. It's just not the right thing to do.
Well, first of all, if only we could all be more like Norway or New Zealand or
Yes.
But our final poll question, Doctor, before we open it up to the Q&A is, have you delayed or canceled appointments with your doctor because of the pandemic? This is critical because a lot of people are putting appointments off that are possibly very important to their health for chronic health conditions. Have you delayed or canceled appointments with your doctor because of COVID-19?
I hope that I'm not a scary guy, so hopefully they'll come and see me, Ileana.
We'll see.
There we go. So we're split even on this. So For the folks who are going to their doctor's visits, I think the virtual platform that we offer here at University of Miami, it is awesome. It's made a lot of things easier for me as a practitioner and for the patients as well. That you take advantage of those virtual visits, and then if you need to come in and see us in person, myself and all the other physicians across the health system, we're more than happy to see you. And every facility that you come to here at the university, we have appropriate, signage to reflect social distancing. We make sure we send you appropriate screening questions. And again, if you have your fever, any signs and symptoms of COVID, don't come to the visit. We can see you virtually. So, yeah, if at some point you're in the, you have the infection, the thing to think about is, when can I start working out? And that's the question that I've received from some of my patients. All right, doc, I'm positive, I'm feeling fine, I have absolutely no symptoms, the test says I'm positive, where do I go from here? So one of the things that we've looked at is, what's the timing of this? So looking at the literature, we've decided, and to follow CDC recommendations, that we have to wait at least 14 days, without symptoms. That's what that's what we're doing for all our patients. The issue is that, like any other virus, COVID-19 can cause serious heart damage. But specifically what we've seen is an uptick in cases of something we call myocarditis. Literally what that is if you have you have your heart, encasing your heart is a thick sac, and that sac can be inflamed or get irritated because of the virus making its way around your body. And the problem with this is it can actually lead to an enlargement of your heart and sudden cardiac death. So you can imagine, if you have the virus, you have some sort of underlying medical problem such as heart disease or lung issues, you're already at a disadvantage. You have the virus, and then you decide that, oh, I'm feeling better, I'm just going to go and exercise. And those are the patients that I want to have a conversation with. Not only the asymptomatic patients, but my patients with pre-existing conditions. Have a visit with your physician before starting your program. Secondly, for the asymptomatic folks, it's important to know that just because your test is now negative, it doesn't give you free rein to go back to your previous level of activity. What we are recommended is a graded approach, graded exposure to exercise with cardiac evaluation to make sure that your heart, one, didn't sustain any damage, and then two, can tolerate your new level of activity. And generally speaking, this phenomenon of myocarditis, it happens anywhere around the 6-week mark. And so again, that 6 weeks tend to be the sweet spot where we want to get our patients checked out. And so, unfortunately, Eduardo Rodriguez, he is currently waiting some of the testing for his heart-related issue, and we suspect he likely had myocarditis secondary to his COVID infection. So that's testament to, if you do end up having this infection, simply don't just wait until your symptoms abate and jump back into exercise. Make sure you speak with a sports medicine specialist like myself. And so, I'll wrap it up by, I don't want to overwhelm you with any algorithms, but this is the current recommendation, and the approach that we're taking to ensuring that we're following the best guidelines to returning you to sports. So if you follow along the left-hand side here, obviously if you're COVID-19 negative, you're asymptomatic, there's no limitation to exercise. We want to follow social distancing and of course wear your mask when you're doing so. But if you're positive, as you can see, the clinical decisions we have to make becomes more complex, and that's where you have to enlist the help of an expert like myself to guide you through these pathways to ensure that we can get you back to your pre-infection status, and you can conduct your exercises in a healthy manner. And so, I think that wraps up much of what I have to say today. These are members of our team, are led by our chief, Lee Kaplan, and our other partners here, Dr. Baraga, Dr. Munoz, Dr. Best, and Dr. Kenstra. And, while our institute is represented by these physicians, we're only a small group of individuals that keep this institute going. We have at least, 30 to 40 other people that are instrumental in helping us to deliver patient care. So we have our athletic trainers, our assistants, we have our nurses, our MAs, our x-ray techs. So it's not just the doctors, it's really a multidisciplinary approach to maximizing your care I'm just blessed enough to continue to have this opportunity to speak with folks like you. And I thank you for your time. And I'll take some questions here, Ileana.
Thank you, Dr. Henry. That's great. And you are a great team over there. There's no question about it. But I remind everyone right now to look at the bottom of your Zoom screen there and look at the little Q&A bubbles. That is the feature that allows you to enter your questions for Dr. Henry so that we can make this as interactive and exciting, because you've thrown out some really key questions here that I picked up on. So I'm going to start off with one of the questions that someone threw out that I thought was very important. This one says, I just recovered from COVID-19 and received my second negative result. Now, what are the chances of getting reinfected with COVID? Because I want to resume exercising and I love outdoor running.
Right. So this a patient like yourself, I would recommend meeting with myself or any one of our team members, because what we will do is we'll start to personalize the approach to you. So things you can do is, one, just because you were infected, does it increase your chance of being infected again? We don't know. We just know you can be infected again. The other thing I must say is this: just because your test is positive, it doesn't mean that you remain infectious. There is some data that's coming out that says that the infectious part of the virus we may clear, but then some of the viral DNA hangs around in our body. And that's what the PCR testing is picking up. So that's where the symptom-based approach to management is, leading the way now. That's why the CDC changed their recommendations recently, saying that for you to go back, we're strictly going to monitor your symptoms, which is what we call a symptom-based approach, versus a test-based approach where you need a negative test to go back. So again, even up to last week, this information was updated. And so this thing is changing. So that's why you have to meet with a specialist, because I have my pulse on what's happening, and other sports medicine specialists across the country, they're also doing the same thing. So again, call us, we'll make an appointment, and we'll be happy to design a program so we can get you back outdoors.
Here's a question from a parent. My child plays league soccer and is anxious to play with his team again. How can we keep him safe and fit and ready to play when the league reopens, whenever that might be, of course?
Mm-hmm. So one good thing to think about is, you can call your coach or your strength training staff or the folks that were on that team that designed some of those, exercise programs to get them ready for soccer season. That may be a time for you to take a little bit more active approach and be a part of a virtual workout, say, with your coach. You have a telephone, you can go to a park and say, Coach, what are some of the workouts we can do today with my son so that he can stay fit? FaceTime. And most coaches, they're going to love that. They're going to say, oh, wow, I get an opportunity to engage with my athletes. That's one approach that we've been encouraging some of our soccer players to do. The other is, of course, if you have the resources, you can get paired up with physical therapists who can look at some of your deficits and begin a strength training program to help to make sure that when you go back to play, we can mitigate an injury, injuries and an injury response to you going back too quickly. And that's where I work with the physical therapist to help design such a program. So it all ties back to making sure that you meet with someone before jumping into the folds, because there's so much information out there and you can easily become overwhelmed. So I encourage all the audience to to meet with us so we can come up with individualized programs for that.
And of course, Dr. Henry, in professional sports, they've been hit hard with COVID, and you, of course, are the team physician for the Marlins, and while not violating anyone's privacy, of course, and all the HIPAA rules and so forth, I mean, that team's been hit, and we're questioning if it happens to them, why wouldn't it happen to us mere amateurs?
Right, and I think, we're in a part of the pandemic where we're learning, and we have to be malleable and adaptable. And while, I like you said, because of HIPAA, I won't be releasing any details in that regard. I think the one thing we could take away from it is that we've gone above and beyond any recommendations by the CDC to ensure that, not only our professional athletes, but our athletes at University of Miami, and quite frankly, our patients have access to those same resources, and we put those things into practice. But we have to be flexible. Sometimes we'll have, a local outbreak, we'll figure out what happened, and then we'll, make measures to adapt. And I think understanding that this process is evolving and taking that approach will help us far more than, taking another approach to say, wow, this happened. While it may happen to me, what can I do to continue to mitigate the factors? And having these conversations helps us to do so. And I think that's why, being a part of this talk was so important to me. And I take it personally because I want to be a part of the solution to help, prevent local outbreaks accordingly. Understanding that even though I may want to do so, I still may have local outbreaks that I have to learn from. So,
yeah. Here's a question that I think is on all of our minds is what types of masks to wear and wearing the mask during workout. Here are some of the things I picked up from what you were saying. Pair your exercises with low volume moves and then short cardio intervals. In other words, acclimate to what the mask creates is almost like altitude training. So expand on this a bit.
Yeah, so I mean, understand. Well, first of all, the folks in the community should not be wearing N95s and exercising. Do not wear an N95 mask and exercise. It is going to challenge you with breathing. We only use N95s when we're doing procedures, aerosolizing procedures, or we're in a hospital setting. You'll be quite fine with, a cloth mask that you can wash daily, that you can build a filter in. And then also those disposable masks now that are now accessible at any of your local, supermarkets or grocery chains. But to that end, ensure that it's a good fit. And again, like you said, slowly acclimate to it. So pair it with that low volume exercise, low resistance, be patient with yourself. Start off with, even if it has to be 2 minutes worth of exercise, don't be ashamed of that. And then slowly increase that amount by about 10% over that 6-week period. You'd be surprised at the end of the 6 weeks, you'll be like, wow, I'm exercising with the mask. And while I do feel like I'm working, I understand my body. I spoke with my doctor, I know my factors, and I know what my body tells me and when to stop. And that's where the personalized medicine comes into play, Ilya.
Yeah. And Dr. Henry, how about those bandanas that people are wearing that, go here?
The sleeves, right. And that's fine, as long as it's made of, that wick material where it doesn't absorb much of the sweat. It can easily allow that evaporation. I'm okay with that. It doesn't have to be your traditional cloth mask. As long as there's some sort of facial covering or buff, that's appropriate.
And here's one that now really evolves to the bigger question here is how many slices of pizza we put in our mouth too, in addition to working out. So
calculate the calories and then, meet with me and I can help design your program so we can get your pizza in there. For sure.
So this one asks, what are the resources to learn more about nutrition and how that impacts my body differently than physical activity? Nutrition paired.
Right, and that's a whole visit in itself. I mean, my colleague Michelle Perman, she loves that. That's her passion. I can connect you with her or anyone in our nutrition department or gastroenterology department. This is where we'll design programs to optimize your particular nutrition state. I mean, quite frankly, some people have, you're allergic to gluten. Maybe if you're over consuming gluten, you'll feel bloated, and now you don't feel the energy to exercise. Maybe you have underlying glucose intolerance, or you have pre-diabetes. You're not getting enough, glucose to your working muscles because of that. Or you have too much glucose floating around. Maybe you have a thyroid problem that we need to check. It comes back to me or any other sports medicine physician assessing what your risk factors are and then slowly integrating that. And then throwing the nutrition piece in is critical. So understanding the difference between a protein, a carbohydrate, vitamins, fats, and knowing what is the appropriate amount. Knowing what your baseline metabolic rate is also important. How much calories you're going to be burning when you're just resting. If you know that, then you can implement exercise to create a calorie deficit and then start to burn some of those calories. And so those are some of the strategies we talk about in our one-on-one visits with our patients. And then I put them over to my colleagues in gastroenterology and nutrition to personalize that program.
Yeah. Because the struggle is real, Dr. Henry.
It is real.
We're home.
It is real.
Frustrated, and we jokingly call it the COVID-19 pounds. And
believe me, I have my vices like anyone else. I mean, I have to stay far from peanut butter and cookies, quite frankly, in the middle of this pandemic. And so we all struggle with it. But I think understanding that the relationship with food should not be antagonistic. It should be one where if you're going to reward yourself, you can have scheduled rewards or timed rewards, or even if you don't want that, you say, you know what, I worked out today, so it's okay for me to, have a little bit of a guilty pleasure, so to speak. And so I think that's where that we want to change our approach to food, and it will change, our understanding of how we can help our bodies to lose weight.
Yeah. Obviously, we can tell from our questions that are continuing to come in, and here's one that we have is the fear of contracting this just from being outside. So this person says, is there a risk when I'm running or bike riding and I pass people without a
Mhm.
mask and I'm also not wearing one?
Yeah, so the current guidelines say that for you to be exposed, the definition of exposure is that you have to be less than 6 feet and spend over 15 minutes in that space. So technically speaking, if you're zooming by someone, and you have a mask on, or you're zooming by you're passing someone and you're at appropriate physical distance, you will have a low chance of contracting the virus. Is it possible? Yes, it is possible. I'm not going to tell you it's not possible, but what you can do is, again, try to, use some of those strategies we spoke about, working out at low volume times, ensuring that if you're riding and you see a large group of people ahead of you, this may be a time for you to stop and take a water break, pull over to the side, wait for that person to, make their way further on along the path, and then resume your exercise. Think about, try to allot enough time to make those changes. So if your bike ride was 1 hour, well, maybe you're going to need those extra 30 minutes to ensure that you can stay away from folks or stay away from large groups. So the scheduling and the timing is critical.
Is it your opinion, Dr. Henry, that all sports are going to have to go into a bubble like the NBA to return to safe play?
Yeah, I mean, we're waiting for the data. That remains to be seen. I think the NBA is taking a novel approach, which is admirable, and obviously they've had it's working for them thus far. We will see, once the other sports start to roll out, and how to approach it, and we'll decide which is appropriate. The the popular thing to say is, well, put everyone in a bubble, right? But logistically, that could be a challenge for a sport like football, for example, where there are large traveling parties, and large number of people that are going to be together in one space. And are you going to say, so are we going to have all these people together in a hotel? How are we going to work that out logistically? Are we going to have all these folks on the sidelines together? So these are some of the things we take into consideration, and we thankfully we have a great operations team here at the University of Miami and in the Department of Athletics, that we're having those conversations, and we're thinking about, and we're putting practices into play that will optimize the health of our student athletes. And then my job as a sports medicine provider is to take some of those recommendations and help convey that to the general public so we can safely exercise.
I would be remiss if I didn't ask you what's going to happen to our Miami Hurricanes.
Yeah, so far it looks like we're going to have a season, and so we're going to push forward. We are giving our athletes the best care. Dr. Kaplan, Dr. Bess are in charge of football, and with my support and the team, and the support of everyone else in athletics, we're ensuring that our athletes get the best care. But not only football, but all our sports. We take care of all our athletes, and we want to make sure that they're ready to go, and safe when it's time to participate.
So I know we're running out of time and so many great questions, but if you had to give us maybe 5 choices for a home workout, some ideas that we
Right.
could all do take home. Like for me, I love Pilates. Other people can love yoga, etc. Can you give us like a little take home
Yeah,
message?
so the simple things to do is, I mentioned earlier in the talk about using objects in your home to mimic weights. So if you don't have access to weights, you can use larger detergent or soup cans to do some exercise moves. So exercises that are going to work large muscle groups, for example, like air squats, are good, where you literally are standing, and you take a seat and you hover your gluteal region around the chair, and you just repeat that movement up and down. And that, generally speaking, will get your heart rate up. Jumping jacks are another good one if you don't have any knee issues. Marching in place, another one. Planks, if you have no shoulder issues. Planks are a good move to do, because that's a good way to get your heart rate up. That's a nice full body exercise. An exercise called a mountain climber, where you're in a plank and you're literally moving your knee to your chest, and going up and down. And so you can look that one up. A mountain climber. That's a good full body exercise to do. Of course, your traditional crunches are always good. And if you have a stationary bike at home, even better. That's a good one. you know, you have services such as Peloton and all these services that will offer scheduled exercise classes. But I'm going to give you an idea. If you don't have Peloton, you know what you can do? Zoom is free. Have a Zoom meeting, get your friends together, get on a stationary bike, you know, play your music, play your favorite songs, and just go at it. Get moving. I think that's the critical portion. So hopefully those nuggets will help with
Those
your
were,
exercise
those
routine.
were all great because I think people are just trying to wrap their brain around how they stay fit and how they stay relevant and so forth. So we thank you, Dr. Henry. I mean, this was great. I think people have learned a lot. It was very valuable and empowering at the end of the day. So thanks for all the time that you've taken with us this evening. And thank you all in the audience for all of your great questions. We just want to assure you that here at the University of Miami Health System, we're here for you. We're here to care for you. We want you to visit uhealthsportsmedicine.com. That way you can learn more about our sports medicine program. You can make a virtual appointment or an in-person appointment with our experts, Dr. Henry among them, and that whole list of great docs that you saw on the screen. So we sincerely hope that you've enjoyed it, that we encourage you to complete the survey at the end of the talk, and that way you give us feedback and maybe even important relevant topics for the future. So thank you, everyone. Have a great night. Wear your masks and stay safe.
Have a
Good
great
night.
night, everyone. Take care. Thanks for the time.